Cardiopulmonary resuscitation is an emergency procedure that combines chest compressions often with artificial ventilation in an effort to manually preserve intact brain function until further measures are taken to restore spontaneous blood circulation and breathing in a person who is in cardiac arrest. It is recommended in those who are unresponsive with no breathing or abnormal breathing, for example, agonal respirations. CPR involves chest compressions for adults between 5 cm and 6 cm deep and at a rate of at least 100 to 120 per minute. The rescuer may also provide artificial ventilation by either exhaling air into the subject's mouth or nose or using a device that pushes air into the subject's lungs. Current recommendations place emphasis on early and high-quality chest compressions over artificial ventilation. A simplified CPR method involving chest compressions is only recommended for untrained rescuers. In children, however, only doing compressions may result in worse outcomes because, in children, the problem normally arises from a respiratory rather than cardiac problem. Thank you for watching. Like and subscribe if you would like to view more of our videos. Have a nice day.